Okay, welcome everyone. Again, in one of the episodes of Who's Who in the Arab Occupational Therapy Group. Today, I have the pleasure of talking to another great Arab OT in the community, Dr. Baraa Barakat. I want to introduce you to Baraa really quickly. I just want to say it's like, hi, Baraa.
Hi, Razan. Thank you very much for interviewing me. I really appreciate that. I'm very happy to be here with you.
Yeah, of course, it's my pleasure too. So, Bara, or Dr. Barakat, I should say, is originally from Syria. He was born and raised in Saudi Arabia, and lived there for years. He earned his bachelor degree in occupational therapy from Hashemite University in Jordan, another Jordanian.
Huh?
And he completed it in 2006. Then he returned to Saudi Arabia and worked as an occupational therapist in a hospital and outpatient clinic in Jeddah for 3 years. Then he
Mhm.
transitioned to the medical industrial field,
Mhm.
working with Medtronic and Kimberly-Clark for 8 years.
Mhm.
And then in 2017, luckily, he moved to Florida, the USA,
Mhm.
to pursue or to become a registered and licensed OT in the United States.
Mhm.
Then later, he enrolled in a post-professional occupational therapy program at the University of Medical Science in Arizona.
Mhm.
And during his studies and registration process, which we may all know it takes a long time sometimes, he worked in rehab as a rehab aide to better understand the U.S. market's needs. He has experience in acute, inpatient, outpatient, orthopedic, hand therapy, mental health, and home health settings. After graduating and obtaining his registered status and became a licensed occupational therapist, he continued his education to become a certified physical agent modality. And
Mhm.
now he's not busy enough. Now he's a PhD candidate in
That's true.
rehabilitation science. So that's really exciting. But then not only is he studying for his PhD, he's still working in hand therapy and home health.
Mhm.
Until last year, he relocated from Florida to California. Stop stealing our OTs, California, to work for a PACE program focusing on
Mhm.
outpatient and community care for aging individuals. He is still doing home health as well. Welcome, Dr. Bara. This is such a
Thank
long
you.
bio.
Thank you.
Yeah,
Thank you.
so excited to have you here. And obviously, this is one of my favorite people I like to talk to, that because not only you have that, connection to the Arab identity, but you have so many different layers of that Arab identity based on like where you lived. You lived in Saudi Arabia, you lived in Jordan, you lived in Syria. So there's so much to talk about. So I'm really excited to dig in.
Thank you. Thank you.
Okay, so let me start by asking you just about you, the person, like, who you are as a person. So tell us a little bit about your connection to the Arab identity in terms of culture, the language that you speak, the traditions that you identify. So who is Baraa Barakat?
So I'm Syrian, and I live in Saudi Arabia for I was born there and lived there all my life, and I moved to Jordan. I study occupational therapy. I returned back to Saudi Arabia. I worked a couple years, and I moved to USA. Uh, I start the journey of registration license. I got my OTD and finished my license registration and start to working. I start working in hand therapy and outpatient, and then I moved to California PACE program and home health. And I speak Arabic originally. Um, English my second language.
Mhm.
I wasn't that good in English 8 years or 7 years ago, but with the practice, with the engaging with the people, what I did during my study to involve in many sitting, that helped me a lot.
Mm.
Helped me very, very much. It's not only a language, it's also helped me to understand the people, the culture. You have no idea how much I was surprising about some people Like I give you example, maybe funny a little bit, but it's for me it was like worrying why he did that. Like sometimes I return back from my lunch and one of my coworkers asked me, "How was your lunch?" I don't know what's that. Why you ask me about my lunch? It's just it just I didn't misunderstand, but
Yeah,
it was
yeah,
weird to me. It's
yeah.
like weird to
Culture.
me. Yeah. Or sometimes when communication, when someone asks someone a question and he asked me, he give me the answer, and the end he asked me, does that make a sense? It's like weird to me. What do you mean? What do you mean by that? Yeah, it does make sense, but it's just different.
Right.
I didn't mean that's wrong, but I mean it's just
Yeah.
different. This is just simple things that make me more involved with the with the market, with the healthcare literature. And I'm happy. I'm happy I gain a lot of knowledge about not only clinician as a clinician, but also about the policy,
Mm,
regulation. You know that occupational therapy outside, they don't have Medicare,
mm,
Medicaid, PACE, a lot of rules. They don't have it there.
mm,
So, and occupational therapy is really here controlled by this. So
mm.
that's the main job to work under uh, um, um, the U.S. Policy and regulation,
Yeah.
and that's helped me a lot um, during my education and my practice.
Yeah. Well, thank you so much for sharing that.
You're welcome.
It's so funny what you mentioned, like, about understanding like the nuances of communication, because like when we think of language, it's not just, us understanding each other, but also the things that people are used to saying to each other on a daily basis, like, how was your lunch? How was your weekend? Like, does that make sense? Like all of these things, it takes a while to get used to it and blend in the
Yeah.
culture, like, and then started understanding it. So this is a great example of that intersectionality piece.
Mhm.
When you see somebody, especially international students or international OT practitioners, remember that it's not just a matter of communication, it's also understanding how things work and how people
Right.
communicate on a daily basis on the little things and the professional things, like you said. So thank you for sharing that. It's really interesting. Okay, so now that we know your connection to the Arab identity, before I move into the next one on our script, I want to, take a detour and say, because you lived in different places in the Arab world, I'm really curious to know, I was like, what is your reading like? How is each unique culture, or like how is each of these subcultures, like the Saudi culture, the Syrian culture, the Jordanian culture, how are they different or how they're similar from your personal experience?
Yeah. Ah, sometimes people they are be affected by the environment.
Yeah.
Okay, like in Saudi Arabia is more hot, you
Mm,
know, and they stay more in houses with the air condition.
mm,
That's affect their personality, uh, including me. And in Jordan is different a little bit. Syria is different a little bit. Jordan and Syria is very close. I consider this as a one area.
mm.
Jordan, Syria, Lebanon, Palestine. And they are different a little bit, but uh, I'm not gonna say is um something negative, but
Well, as long as you say
culture,
the Jordanian one
different
is the
culture.
best, we're good. That's the right answer, bro.
Jordan, Jordan, fantastic.
Yeah.
I love Jordan. People nice, everybody nice, really. Even Saudi. Oh my God, that's my people.
Yeah.
Saudi. I love Saudi Arabia. I love Jordan.
Yeah.
Syrian. I am Syrian. So
Right.
everybody nice. It's just different culture a little bit. Different a little bit. Egypt. Oh my God, my love. So, oh, Morocco, Tunisian.
Yeah. Yeah.
That's on my head.
Right.
Like what you're saying, on my head. Like
On my
very
head.
valuable.
Right. Yeah. 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 And
So,
for those who are listening and saying it's like they don't know what on my head means, do you want to explain what on
it's
my head?
very valuable. Like on my head is the top of me. It's very
Yeah.
valuable. That's what
Yeah.
we say, right?
Yeah.
Or in my eyes,
Yeah.
like also very valuable.
Right.
So yeah, so
Okay.
it's different. Saudi Arabia, Dubai, is different than Syria and Jordan,
Mm,
but they are sharing that they are very human people, very nice. They love each other. Um, um, yeah,
Yeah. No, absolutely. Like, I agree. The Arab culture, regardless of what the name of the country is, the culture is there.
correct,
Kindness of caring for each other,
correct.
genuinely, not only like, just, in unity, but also we do care about that. Although that may not be translated really well in terms of political and, economic wellness, but as people, at the levels of the people, they're very kind and caring. And of course, I love them all, as you said. All of these places are dear to my heart. I lived in Saudi Arabia too. Haven't been to Syria or the other countries, but I've been to Morocco. So I share the sentiment with you. I agree. They're all loving and kind. Okay, so moving on to the next one. Describe to us a little bit, and we got to that and in your bio, but tell us more about your current professional OT life. How does your clinical experience, again, like from the lens as an Arab OT, and you shared, briefly about that, but like your role in the program that you're enrolled on now as a PhD candidate, your professional activities as an occupational therapist, if there's any leadership roles, like who is Baraa Barakat, the Arab OT practitioner, in a sense?
Yeah. So when I came here to US, and I am already occupational therapist, and the program in Jordan, even in Jordan, most of this program is accredited by the World Federation of Occupational Therapy. It's accredited, so that's mean this program is standardized the way of in a US, and but when I came to US, the National Board of Occupational Therapy, they have certain regulation that you need to be higher standard, and they ask to be more involved with either with another master degree or a higher degree. Just they need a higher degree, and then after that they need to get all this whatever you study. They put it all together, and they trying to see which one that you miss and you need to do them. So this process, it's make me really good clinician. And to be honest, it's a longer process, is really hard, but it's make me really, really good clinician. And I'm not gonna compare it with the same education here, but that's give me really good, make me a very good clinician. And then after that, I be eligible for the exam, and the exam you have to study it, and once you pass, you are really good clinician, very competent to be work in a US.
Mm.
I think this is a really good idea, and make people who come from overseas really competent, and they know what to do.
Mhm.
They know how to treat people. They know how's the market. And they make you more involved. I become more addicted with occupational therapy. So I have to see CPAM, Certified Physical Agent Modality, okay, rehabilitation, PhD. I start to be addicted.
Yeah, that's
So
about.
that reflect on my patient, that reflect on my how to treat patient, how to treat them equally. It doesn't matter where you are from, whatever your color is, your skin, whatever you believe. It's become occupational therapy is become part of my personality. That who it is. Wherever you work, and also that's reflect also with your clinical judgment. It's not about just to hold the patient and just to treat them, do exercise.
Right.
This is not the best practice. It depends on what setting you are in, what is really the patient need. What's the difference between physical therapy and occupational therapy? That's big difference. In some point. So what I'm trying to say is that as occupational therapist in the US, it's make you a good practitioner to what is really help the patient. It's not about just spend the time with the patient and just give them anything. No, it's really help.
Yeah. Well, thanks for
So
sharing the journey. Like it sounds like you have as an OT right now, like you've evolved and you've become like this practitioner with so many different skills under your belt with, with OT in different settings. So, and that's inspiring too, and very wise words about, the national board, making sure that people are competent and they are ready to take on entry level, practice. I agree with that because I went through the same process too. And it is a rigorous process. It's meant to make sure that we have the most qualified, occupational therapy practitioner going to serve the client population. So I agree. And with that, it seems like you've benefited a lot from that process. You took it with open arms and you become like this multi-skilled practitioner. So it's great to hear. Um,
It's really rigorous. It's really strict
yeah,
curriculum.
yeah,
Very strict.
yeah. In a good way. In a good way.
In a
So
good way. In a good way. This
yeah,
is why it's really strict. Yeah.
yeah. So this is a shout out for NBCOT for doing a great job with this. I totally agree. Okay, so let's talk about I think we kind of covered, your OT background and your education. So that's great to to learn of one more qualified, highly educated Arab OT in the US. And this is the point of having these series is to know it's like, do you know about this person in California? Do you know about this person in Florida? So this is great. So for those who are listening, here's one highly educated, very qualified OT at the West Coast. So get to know them if you don't already. Okay, so switching gears to another aspect of this series and why we want to talk to you about it today is your intersectionality of being an Arab and being an OT. And let me preface by this, being an Arab OT or an Arab individual or an individual with Arab identity these days is not necessarily the easiest thing to live with. Given all the events that are happening in the world and the Arab identity, it's not really easy to see how that fits in our professional and personal roles. So can you tell us a little bit about how you being an Arab OT, how that intersection between being an Arab OT and in the US, how does that work? Like, how do you feel walking to your practice every day as an Arab OT?
Um, so I was a little bit surprised about how the people they can accept a person from he is not native English speaker in a positive way. So the people they in every session, whatever I see the patient, let me guess, where are you from? European, whatever, Russian. And that to create a really good a relationship between me and the patient. And their acceptance is very nice. So they when I see the patient, their acceptance, when they start talk to me, I talk to them, they get to know me, I get to know them. That's build good a relationship, client-centered relationship, and that affect on the treatment or the therapy. They accepted. I didn't feel anything wrong. I didn't feel like they are like you are not native English speaker or not study here, so that's wrong. I didn't feel that. That's really good. I felt in the opposite side, people they more accepted, maybe because they open more dialogue and communication and get to know each other. So he started to tell me more. He started to tell me more about his history. Started to tell me more about he be me, he or she be more open to me. That's help the therapy. Building a relationship and trust between the client and the therapist is really important. That's reflect on a therapy, and this is a positive point of to be Arabic,
Yeah,
to be non English speaker.
yeah.
Yes. What else?
Other than the language, like how does it feel? We all carry part of our original identity, no matter where we go. a piece of us will stay with our culture, and we carry these traditions and these cultures, whether it's the values for caring for one another, whether it's the values of like generosity. So this is part of who we are, and this comes from that Arab identity. How does that reflect on your relationship with the patients? Like, how does the Arabness shine through when you are dealing with the people? It sounds like, you being open to that warm communication with the patient, that's one way of showing that Arab identity. What else, like, you feel that um comes when you are interacting with the patients, that is like that's the Arab side of you shining through?
You know what, Razan? I noticed this one in my personality. You know, Arabs sometimes they have all people nice, but
Mm,
Arab they have this emotional things like
mm,
like kindness, kindness. When you see, in Arab, when you see people on the street, you help them.
yeah.
Everybody do that, but it's like they have this in our culture,
Mm,
and it's become, tradition in Arab. That's it's reflect with the OT that you need to be good with the patient, whatever. That's give me a really good feel with the patient and empathy. And sometimes it's become too much. I give you, yes, it's like it's like nobody come to my patient. Like when I was with the organization,
protective.
very advocating,
Yeah.
very advocate. Nobody come to my patient, like even my supervisor, Barat, try to be like a little bit,
Yeah.
is sympathy, empathy, whatever.
Yeah.
And yeah, so try to be more like a therapist with a therapist, like a professional relationship. It's still professional, but it's in my personality, it takes a little bit extra step
Yeah. No.
because of an Arab, I feel like she is my mom. You know, this Arab, how they say, I feel she's like my mom and she need help. If I didn't help her, who gonna help her?
Mhm.
That's too much.
Yeah. Well,
That too much is
yeah.
sometimes I take it emotional. Yeah.
Yeah, yeah. I think this is such a great point that you bring up, because you are tapping on the lines between professionalism and, compassion. And definitely, I agree with you. Arabs, we are very sentimental and very compassionate, and that comes across sometimes. You called it emotional. I called it sentimental and compassionate, and it only comes from a place of care, of kindness. And where we live right now, it may be perceived as extra, or like non-professional. But this is a conversation for another time. It's like, is that non-professional or is that cultural? That's a good question. So, and again, like, like I could say in Jordan, for example, I practice in Jordan, and that was completely acceptable, and it was never taken as non-professional to show extra care and kindness to the patient.
Correct.
That was very well received. That was welcome. Family and caregivers, when they see the therapist showing that care, they feel that their client is protected with them. They feel that their like mom or dad or family member is in safe hands because of that compassion that comes through. So I don't blame you. We are programmed to show that. That's a good thing. You come to the US and that becomes unprofessional. So I see the struggle there. I'm glad you recognize it, because we also want you to be recognized as a professional, but I also don't lose that extra piece of love, because again, it's warmth, it's kindness, and definitely builds rapport with the client.
I do. And sometimes, to be honest, this is my main problem with the OT. That's the main problem I face. To be very emotional, especially because I work with elderly people.
Yeah,
They
yeah,
are really helpless,
yeah.
weak, sad, depressed.
Mm,
And you came to you, it's just please just help me.
yeah,
And most of them, when I lose my control, when they are in pain, that it's
yeah. It
that's
hurts.
another
Yeah,
story. So I starting to, send an email to the primary care doctor and the other nurses, and hey, please, see, let's do
yeah,
another mini meeting, how to reduce his
yeah.
pain. And they and and they call it unprofessionally, but they feel like it's too much on you, Bara. Just a little bit, lower your tone a little bit. But that I feel it.
Right.
That
Well,
I feel
that's
it.
definitely a conversation for another time, passion and compassion for your clients. So I'll keep you in my mind for that conversation.
That side effect to be Arab, you know,
The side effect, I like that. Okay, so I want to shift gears. Like you touched on, like the struggles of being an Arab, in the negative sense, but I want to switch to not a professional sense of the context of OT. I want to switch to is there an like the social aspect of things, blending in as a community member? Can you talk about the struggles or negative aspects, not necessarily in the OT world, or it could be in the OT world, to your
yeah.
intersectionality, you becoming, or like you being an OT from Syria, lived in Saudi Arabia, graduated from Jordan, now a PhD candidate, working in this setting. What is the thing that you wish wasn't there? What is the negative thing that you wish you could wipe away because of that mix of your identities?
You know, we are a human, human factor. People do mistakes, and according to, according to many factors, like different religion, different thought, different experience. So you can see some patient that they are biased a little bit, and you can see misunderstanding. They have misunderstanding. Um, yeah, bias, misunderstanding. So my role is to overcome these with
Mm,
the communication, with showing that I'm here for help. Um, if they don't want to go to be more social, that's fine. I'm here just for to help you and try to overcome this bias and misunderstanding. Um, it's rare. It's really rare to me. It's happened to me. It's happened to me one time.
mm,
It was misunderstanding, not because I'm Arab, but someone, uh, the patient. Uh, let me just tell you the story. Very simple, very simple.
yeah.
When I start working and I start my caseload, one of my caseload was there is a patient, and this patient was discharged from OT before I came in.
Mm,
So I met this patient, and she thought that I'm the one who discharged her, and she's from different religion, different cultures. So when she noticed that I'm Arab, so she thought that I am the one who discharged her, and she just like uh, no, don't talk to me anymore. You know this thing. So
mm,
I just told my supervisor, please restaff it to another therapist because
mm,
it's better for
yeah.
it's just better for the patient, not for me. For me, I understand that she's a she's a patient. She's an elderly person, and I don't take it personally at all. But in these cases, the best way is not to, you cannot change her. I tried to just explain to her misunderstanding. She didn't accept it, so I give it to another person,
Mm,
another therapist. So it's happened.
yeah.
It's happened. Bias, misunderstanding, misconcept that Arab, they are not different. They are, whatever.
Yeah.
Uh, every person has his own misunderstanding. But I didn't see it. Honestly, I didn't see it too much. Most of my patients, very happy, very nice, very good, very acceptable. I don't know what's in their mind, but what I see from them, they are very acceptable, very nice. I didn't feel any bias. I didn't feel misunderstanding, just a little bit, but I didn't have this problem.
Well, I'm glad you say that. Like,
Yeah.
but again, like bias and implicit bias and discrimination is it's a sad or unfortunate part of the human nature sometimes. But I'm glad that this is how you cope with it, that you overcome it with communication and by leading by example. And I respect that and I appreciate it. And that's a great message for others who are struggling with this, especially these days, as you said it, this is a heated time for so many reasons we're not going to get into. But I'm a firm believer of communications. Like, yes, we have to get through it. We have to show a better example of communication, show kindness and compassion. So it warms my heart that you're dealing with it this way. So I respect that. Keep that
They
though.
feel it, Roseanne. They feel it. When you speak to them and when they saw how you treat them, they really feel it.
Yeah.
With every patient, they feel that you are care, you are nice, you are there for them. They really feel it. Even if they don't, you know, they have misunderstanding or bias, they feel that you are there for them.
Yeah.
And that's really good.
Yeah, that's the hope that human nature prevails and like, that
Yes.
we are like one species that care for each other. Well, that's a good lesson to walk away with. So thank you for that. Okay, I want to ask you also, can you tell me how you practice, share an example from your practice, how a non-Arab OT can show cultural humility and understanding when they are dealing with an Arab client. So you're an Arab OT. If you are to treat an Arab patient, you will know that area because you know this. This is your people. You know the culture, you know the religion, you know that intersectionality that we talked about. What would be your message or like an example, a clinical example or a practical example for someone who's not an Arab and treating an Arab client? What is your advice to them?
That's really nice. So I believe most of a clinician, in general, I believe all people nice, all people nice. That's my belief. Especially the clinician, the therapist, even occupational therapist, physical therapist, they are trained to treat people in respectful, in quality, with no bias.
Mhm.
But sometimes the language barrier, it's a play language barrier and different culture play rules in communication and the therapy in the therapy.
Mhm.
So I have like example patient, she don't speak very well English and she was treated by a therapist, another therapist who is a non-Arabic speaker. And um I requested when I saw that how they treat her, whatever, it was good, but because of the language barrier, even there is a translator, certified translator, it's not that great.
Mm.
It's not that great. Not because of the low competency from the therapist.
Yeah.
No, the language barrier is really important.
Yeah.
So I ask if I can treat the patient, and if I become my in my caseload and I start uh, treat the patient, and it's that make a difference.
Yeah.
I even send that the primary care, her primary care doctor, he is a not English speaker. We have a doctor is English is an Arabic speaker.
Mm.
So I even switched the doctor, her primary care to be Arabic.
Yes.
So the patient was very happy, very nice.
Mm.
He really did received better care, not because of competency of because of the language barrier. So she can communicate more. She told me what she need. She told me what's happened, her history, what she has right now,
Yeah.
what she need, what she expect, and and
Yeah.
that's really important. And if there is non-Arabic patient, sorry, non-Arabic therapist, I can explain to them, hey, you can uh, don't misunderstand
Mm.
different culture. Try to involve another translator who speak Arabic to get more knowledge or to answer any question you have.
Yeah.
And that's it. Or otherwise, all people the same,
Yeah.
all people the
That
same.
this is such a good example of like, it's not just the language also. It's like you mentioned two things. You mentioned the language, which is a translator may be the like an okay solution, but nothing is better than having someone who understand the meanings behind the language. It's not just like communication with words, it's also
Right.
the how, the tone, the compassion that goes with it. This is part of the language. So the nonverbal
Correct.
also matters. So I agree. This is such a great example. So
Okay.
sometimes, and this is a great way of advocating for your clients, switching that primary physician. I'm glad that was an option on the table. But this is one way of advocating for your client. Ask for someone who may be more familiar with the culture. And again, to your point, it's not for the lack of competence. It's because it just works better when you understand where the patient is coming from. And this is exactly spot on cultural humility. So thank you for
I
sharing
agree.
that.
I agree. I start to tell all my other therapists we are because we are,
Yeah.
you know, where we work, where I'm working, there is many therapists. Everyone has caseload. Start to tell them, hey, any Arabic patient,
Yeah.
give it to me, give it to me. Not of bias, because I can give because of the language and the
Yeah.
tradition, they can get they
Yeah.
can get what they want. And
And
this
this
is
is
why they are here.
And this
They are
is well said.
innocent.
This is well said, but it's not the bias. When you say send these patients to me, this is exactly what they may need if they are like, having a problem with communication. So for all the OT who can speak the language out there, or at least familiar with the language, don't be shy to say, I speak the language, I understand the culture, send these patients to me. This is good practice because you'll never know who needs that and they don't know that you speak the language. So this is a great example and message, I think, for those who identify with the Arab culture.
Of course, advocating. To give you example, like this patient, he needs they need a standardized assessment, the ACLS, the one that I think your mental health, maybe you know it.
Yeah.
So because of language barrier, the therapist she couldn't do it. The patient he didn't do it, couldn't do it, and that's reflect on the okay how cognitively the patient
Yeah.
is, how his problem solving, how she is a short memory, long term memory. It's make a difference. Languages make a difference.
This is such a good point, like how language, when we standardize assessment tools, do we ever consider if the patient is not speaking the language, how is that still valid and reliable if the instructions are not going to be delivered the same way? So this is a brilliant point to bring up. So I'll keep that in mind too. Okay, so we only have like two more questions to wrap this up. One, what would be your message to the allies and our friends in this group, the Arab American Occupational Therapy Group? We have a lot of wonderful, wonderful friends and allies that I dearly respect and value, who not necessarily have any connection to the Arab identity. And I came to appreciate them so much because solidarity and supporting one another, regardless of who we are, is invaluable. It's amazing. So what would be your message to them, these friends of the Arab community?
What's the message from me to them regarding what? Regarding how to treat patient in Arab or about us?
About
About
us,
therapists.
about the community, this group. It's like if they're there for us and I love their support. What would be, if you are to talk to them, what would you say?
We are nice. Don't mess with me. I'm joking. Arab is a nice people, and they are there is different culture, different environment,
Mm.
and they are competent, very competent, and um, um, if they are treating the patient, they are doing their job, uh, and make sure that these patients they will receive the best care they can get from the
Mhm.
Arabic therapist. Um, if there is misunderstanding, please go and communicate with the Arabic therapist. So maybe the open communication, it's answer a lot of question.
Yeah.
These questions sometimes is a cultural question, religion question, and practice question, and bias question.
Yeah.
So keep communication with the therapist and see how it goes. If you have any question, look for the answers. Look for the answers. Give you example. Maybe a non-Arabic speaker, a therapist, see Arabic speaker therapist with the other patient, and maybe they will understand what's going on. So it's better for the therapist to ask the Arabic therapist what's going on, what's happened, so
Yeah.
they can get the answers.
Yeah, no, I agree with you. Like I'm a firm believer of I lost you here for a second. I'm a firm believer in communication. I think nothing beats communication when it comes to overcoming the misconceptions that you said and the biases. And that would be also my message to the allies. Communicate, get to know who,
Communication,
yeah, get
of
to know
course.
them, ask questions about anything. There's no big questions that we can't answer. So that's a great advice. Okay,
Yeah.
I want to end with the last questions. Oh no, actually, I have two questions. One is, what would you like the Arab American Occupational Therapy Group, us as a community, what would you like us to do in the future to support the Arab community?
Ah, I recommend, if you have, maybe in the future, if there is any communication between the World Federation of Occupational Therapy, between World Federation of Occupational Therapy and NBCOT, how
Mhm.
to transition from outside OT to the inside OT. It's really very important. Like,
Mhm.
even some people who study with me and they still live in Dubai and they would like to come here and they have this problem. They keep asking me what to do, whatever. It takes me too
Yeah.
much effort and time to be in, to do this transition. If there is, I really recommend that, if Arabic, American Arabic of Occupation Therapy, they have this support to support these people to transit from outside to inside US. That would be very helpful. Another way is maybe job. There is a lot of job. I know there is a lot of job, but
There's
it's
a lot.
cool to have this supportive community that if I'm occupational therapist and Razan, she offer me a job, I already have a job, but maybe that would be cool.
That would be cool. Yeah.
That would be cool to, to work with the people that you are happy with.
Yeah.
That's cool. It's not a bad idea. The working environment is very cool, very nice.
Yeah.
Another thing is professional development courses.
Mhm.
And so you are a professor and you have a lot of knowledge. There is another people there, they have a lot of knowledge. If we are support each other to improve our competency in
Mhm.
occupational therapy, that will be cool. I'm really interested now in community with the aging in place and to get certification of to be certified aging in place specialist.
Mhm.
I mean, if that's something that Arab American occupational therapy they can provide it, so they can help me either with the advice,
Mhm.
with the contract with the national real estate. I don't know the name of the organization. That helps too. Professional development, it's helped. It's really cool too.
Yeah.
So these are three things:
Yeah.
professional development, job opportunity, and transition.
Yeah, no,
That's
these are great. These are great ideas. And the reason I'm asking is like just in case someone is listening to this and also have other ideas, that would be great to connect. So some of the things may be within the scope of us, and some of the things maybe we can explore, like bridging the gap between the World Federation accredited programs and NBCOT for those who wants to come and work in the US. So this is something we definitely can look at in the future. So thank you. Great suggestions.
I will add something cool, which is we already have, because
Yeah.
I'm a member also for Arab American
Yeah.
Occupational Therapy. Sharing information is really cool.
Mhm.
Sometimes I find when I was interested with aging in a place, I already contact Dr. Nafadi
Yeah.
and about how, because he's certified.
Yeah.
And so I ask him, how are you doing? What's your advice? He give me really good advices, very good knowledge. That's really something good that our organization that help and support each other by sharing practice, experience, thought, knowledge. That's really cool. I love that.
That's good.
Okay.
All right. So I'll add it to the list then. That's great. Okay. So in less than a minute, if you can, and we're gonna end with this. If you can debunk one myth about Arabs, tell us one thing that everyone think is true, but it's not about the Arab community or Arabs in general.
So so in my where I work, they don't, I don't know, maybe part of my personality. but they think they have this thing that Arab, they don't, they don't care.
They don't care.
They don't care. Maybe because I'm very whatever, but they don't care. Hey, you don't care. Whatever. We don't care.
I like you chill.
In positive point, in positive. It's a joke. It's a
Oh yeah.
positive. It's like Arab, they don't care, you know. It's not like
Yeah.
you can say it's a very self-confident or very
Yeah. Yeah.
you know, very tough, very, you know, like very calm.
Yeah.
You can say it whatever you want, but this is how they call me. Hey, Baraa, you don't give a damn or whatever.
That's not a
But
bad rep.
it's not, but it's a positive, it's not negative. In
Yeah.
positive. So they don't, yeah, Arab is different culture.
Yeah.
It's really different culture. So Gulf area is different than Sham area,
Yeah.
different than the north of Africa, different than Egypt with Sudan
Mhm.
or Djibouti.
Yeah.
And so it's different culture and different religion. There's many religion. There's a Muslim, Christian, Jew,
Mhm.
and it's different mentality. And you know, they're different than any other nation, but they are sharing, they have sharing with really human people. Like
Mm.
there's many emotional and humanity. They have a lot of humanity.
Yeah.
And that's what I love in Arab, really. That's what I love. But this is the more things, you know, if you are Arab, that doesn't mean they are the same. They are different people, different in, you know, different environment
Right.
and different culture.
Yeah. That's
Different.
that's always, my favorite people when they say this, like, it's not a monolith. It's a lot of subcultures and within the cultures. So yes, that's a
How
great
many country? Like maybe 23, 21, 23 countries?
22 so far. Last
22?
22, yeah. So
22 country? That's a lot. How many population? Maybe less than 1 billion. No, I don't think so.
oh no, we're less than a billion, yeah.
I think.
Yeah, well, we'll see. We'll see about that. But yeah, thank you so much, Baraa. It's been
You're welcome.
a pleasure getting to know you, and hopefully people will connect with you. And in California, for those who are listening from California, connect with Baraa and share your love
Most
for
welcome.
Arab identity. Okay,
Most
Baraa, thank you so much, and hopefully
You're
we'll have
welcome.
you again. And stay connected and stay on the lookout for our future events that are coming soon.
I
So
would love to.
good to see you. Thank you, Baraa.
You are welcome. Thank you. Have a good day.